Good evening, everyone. Thank you all so much for joining us this evening. I'm Dr. Edith Bracho Sanchez. I am a pediatrician here at Columbia Children's Health in the Department of Pediatrics, where I lead our external affairs team. We have an exciting evening. We are partnering today with the Graduate School of Journalism and the School of Public Health to talk about health in the era of social media. We're really hopeful that this conversation will be of use to both physicians and parents in the audience. While we give everyone a minute to join, let me just remind you that we are on all social media platforms at this point. Please follow us at Kids at Columbia. We're on Instagram, we're on Facebook, we're also on Threads, we're on LinkedIn. We advertise a lot of our events on there, as well as promote some of our experts. So please give us a follow. We also would love for you to sign up for our newsletter, which is getting slowly better and better. We have more and more information that we're hoping will be relevant to you all. And without further ado, let me introduce the amazing panel of experts I have with me this evening. First, I have Dr. Randi Epstein, who is a journalist, a writer at the Columbia Graduate School of Journalism. I also have with me Dr. Melissa Stockwell this evening, who's a pediatrician, a vaccine researcher in the Department of Pediatrics, and Dr. Renata Schiavo, who is a global health practitioner at the School of Public Health. I will start by telling you that these doctors are not only incredible, what I show you on the screen is only a fraction of what they do. We missed in the, getting ready for the evening today, we missed telling you that both Randy and Melissa have MPHs from our School of Public Health. So very relevant to the conversation this evening. And Renata has a master's in journalism and mass communication, in addition to leading a journal. So I'm just so excited to have you all. Thank you for being here. Um, so while we, again, allow everyone to join, and a reminder that you can send us your questions via the Q&A this evening, we will get to as many questions as we can. We will be saving time at the end, so definitely send us your questions. I think a good place to start the evening is perhaps by laying out what the challenges are in health communication in this moment in time. So, Melissa, as the pediatrician and vaccine researcher, I'll start with you. What do you see as the challenges in this current moment?
Yeah, I think from the pediatric perspective, there's a lot of information that's out there, and I think parents are sort of aren't sure sort of what to believe, and they're trying to do what's right for their children, but again, they don't know necessarily which sources to trust. They don't know which information is real, and sometimes it feels easier not to make a decision in that situation rather than seeking care for your child. And so I think I always say to families is if you're unsure, just talk to your child's pediatrician. And if you're unsure about your own health, talk to your own doctor. That's what we're here for. We really want to hear if families are have questions or are struggling. We want to be able to give them information that they can trust, help them think through things, and answer their questions. So if you have a family that's struggling and you're struggling at home, please reach out to your doctor. That's what we're here for.
Yeah, no, absolutely. And we are slowly becoming more astute at helping families, and bringing real life things that they are finding out there into our clinics and helping them sort of think through and sort through all of those things. Renata, from a public health perspective, what do you see as the challenges?
So the main challenge, in my opinion, is the global trust crisis in health and science information, and also the erosion of social support for parents, for families. They need to make the right decision for their children. These two issues became by far more prominent during the COVID-19 pandemic. This was such an extraordinary event that people almost had to blame someone, stop believing in something. But we know that these are not new issues. We know that misinformation, disinformation has been fueled for centuries. Things like stigma, mental illness, stigma related to obesity. But these issues became very prominent during the COVID-19 pandemic. And they are interconnected also to weaker health and social systems, systems in which clinical settings are only one component, but we have also, other components like for example, the information ecosystem, the social structural determinants of health, and a variety of different items that contribute to confusion. And also, as you have set up, Edith, this is also being amplified by social media because spreading misinformation is much faster, is much rapid on social media, and reaches by far more people than before with other more traditional media. So I think that we need to make it easy for parents to actually navigate this confusion, and especially for those parents who unfortunately have limited opportunity to connect with evidence-based information, or have to work 2 or 3 jobs to put food on the table, or have limited time to take health decisions. So I want to reinforce what Melissa was saying before: talk to your pediatrician, talk to your doctor, but also we will speak about other items that can happen across the health and social systems.
Yeah. Renata, I have to tell you, I had a moment in the pandemic, maybe it was the moment when I was coming home and everyone was sort of cheering for healthcare providers, right? And everyone was like so excited, and it looked like we were collectively looking at the vaccine development that was happening and thinking, this is such a heroic effort. And I just sort of remember thinking to myself, like, oh, like maybe now, like people will believe in doctors more and will trust doctors and will champion doctors. Like, and now I'm sort of thinking back and I'm like, wow, maybe that was a little naive of me. But I think for a moment there, maybe we had a chance. Why do you think, Renata, that didn't happen? That it wasn't a moment of rallying together around science and around doctors?
Well, I think that historically speaking, we know that every moment of progress towards supporting science, towards supporting health equity, towards supporting evidence-based information are always followed by some setbacks. For a lot of those issues, to be honest with you, are not covered as prominently by the mass media as they were at the height of the pandemic. So some awareness has declined and also has contributed to less momentum, and is really up to all of us, including through this kind of conversation, to keep the momentum going, to support evidence-based information, to keep it in the media, to keep it in our organization, to keep it in our clinical practices or global health practices, and making sure that people are constantly reminded of the importance of these issues.
Yeah, I love that. You're giving us something to sort of, we can all do, which of course is in many ways what we're looking for, right? Like, how do we do this? How do we keep it going? So I really appreciate that. Randy, as a journalist who also has an MD, who also has an MPH that we left out of our flyer, what do you think the challenges are here?
Yeah, I think the challenges, and my comments dovetail what Melissa and Renata have said, but coming from the journalist point of view, I think our challenge is it's not so much misinformation and real information, but the way social media, and I think all media now, is crunching things down to sound bites. And it's very hard to say the truth about something in medicine and health. That's most things are not a sound bite. Most things, as Melissa, you know better than I do as a practicing pediatrician, and Edith, you too, that you don't have one blanket statement for all of your patients. So people are hearing, this is what to eat, this is how your kids should be, this is how much your children should be sleeping. So I think we need to encourage, doesn't have to be longer form 8,000 word pieces, but I want to push back against, and I try to teach, push back against sensationalism, push back against this binary of right and wrong and these umbrella statements. I also think, and what Renata was, what you were bringing up in terms of trust, I really do think that people trust their own doctors. I don't think that's, people like to say, I don't trust doctors. They mean that in the abstract. They mean that in when someone gets on television. But then they do trust really implicitly, at least from my anecdotal evidence, people really believe what their doctor tells them. So I guess I'm just hammering in what has been said before. Go to your doctor, ask them. And I don't think there's been like, I don't know many people that walk out of their doctor's office and say, I don't trust them. I mean, they'd switch. They wouldn't come back to you. Once they're in your office, I think there is that nice relationship. That said, we do need to build up the general public health trust. And I think that falls back again on not sensationalizing, not saying that things are 100% guaranteed to work. And this is the way every child should be raised or fed or medicated.
Yeah. Randy, I am curious though, you know, on the one hand, of course, we shouldn't sensationalize. I hope that every health journalist and the way that they are trained and the way that their editors are sort of looking and reviewing, through everything that they write are, thinking we shouldn't sensationalize, we shouldn't scare people, we shouldn't, there's a number of things that we shouldn't do. And at the same time, I think the bottom line has changed, right? For a lot of media organizations who rely on ad revenue and clicks, right? And that's true, I think, both for traditional media and also digital media. And I don't know if I should, but I'm sort of including these large social media platforms and the digital media ecosystem. So when you think about, what the bottom line unfortunately has become, how do you train young journalists? And I think this applies to physicians who want to work and partner with people like you, Randy, with health journalists. How do you train them against, right? Or perhaps to combat in some ways that reduction and that sort of clickbait that I think the whole system sort of moving towards?
What I say, which might be overly optimistic to my students, that our readers are a lot smarter than we give them credit for. I really do think that most people, when they see every child has to have this, make sure every child has this supplement, I do think people are getting like rolling their eyes to all of this again. So I think people are smarter. I think we have to convince our editors that our readers are smarter. I think people like to hear the nuance. They like to hear the ins and outs. So that's what I tell my students. And then I think readers also should know, there's a savvy way that people that are reading the information, which I know we're going to get to later, and what people can look for in that. But in terms of training journalists, I really push them. There's something really exciting about getting the nuance. And also, if you think about it, parents get it. Not if you have more than one child, your two children are not the same, and you're not raising them exactly the same. So, and that's just an N of two. That's a really small study, but I do think parents get it, and I think they appreciate. I think readers appreciate the nuance that we can give them. That here's what you can be confident about, but there is a small chance of X, or here's what most people, or this might be right. And if it's right for you, talk to your doctor first.
Yeah, I appreciate that. Um, Now, I do think, and again, I think, in all of our answers in our discussion that we're having so far, the current landscape for health information is tricky, right? I think it's sort of like no brainer, no doubt. I think we can all acknowledge it's a very tricky landscape out there. I do feel, though, that a lot of the responsibility of sorting through it all is placed on parents, it's placed on individuals. And I definitely want to get to some of the solutions and what we can do as sort of the consumers, right, to sort of empower ourselves. But I first want to ask you all, whose responsibility is it to fix this, right? And I know that that's a loaded question, and maybe we can go to you, Randy, to give us your take.
Oh, I think it is the journalist's responsibility. But when I say journalist, I don't just mean those of us who write for newspapers or books. I think science journals too. We tend to think that if something is in a scientific journal, therefore it means it's peer reviewed, therefore it means that it's a great study. And now a lot of times people can get access, just ordinary people that can get access to what's coming out in the journals. And I think we have to realize that some things slip through into peer-reviewed journals that shouldn't be there. Some of these studies aren't great. So I think in science, a lot of these science journals, they're a business. So I think we have to appreciate, that they have a lot of the same. We tend to think there's the science journals that are just for good and publishing objective science. And then there's the newspapers, which are out to make a profit. But they're all kind of in the same ethos, in the same system. So I think there's pressure on all media to make sure that what they accept as accurate is accurate. There is a pressure now for people to weed through what makes sense and what doesn't. And I know we're going to get to that after. How can you tell? But I feel it shouldn't be. Like if you see something published in the New York Times about a scientific study, or if you see something accepted in the Lancet, a scientific journal, you shouldn't have to do your homework to redo the statistics to see if it was a bit large enough study. But that's where we're at now. You shouldn't have to wonder, like, was the person quoted? Do they have a vested interest because getting in the New York Times or whatever is going to boost the drug company that they're affiliated with? But readers do have to do that, but they shouldn't have to. That should all be vetted out so that all these vested interests. So I think the responsibility is not, yes, there's the responsibility of the doctor, but I think doctors have done that. I think doctors are telling their patients the truth when they come to see them. So I think a lot of the good and bad stuff has fallen on us, the journalists.
Yeah. Renata, what is your take as a public health practitioner who also leads a journal? Communications and health. What is your take? Whose responsibility is it to fix this?
So I have a different take because I really think that the mass media and scientific publication and peer review publication do need to take their share and making sure that we always go through a rigorous peer review process in the case of scientific peer review journal. But I do think it's pretty much everyone's responsibility. When we think about the health and social systems in which we operate, we think that information is distributed through the mass media, through scientific publication, through social media, but ultimately the patient, the provider, who is an ambassador for evidence-based information, need to have the kind of social support that we were talking about before. So one of the things that I really believe in connecting with communities, with community-based organizations, with patient groups, to actually understand what they would need in order to trust again evidence-based information. And I agree with Randi that actually clinicians are the most trusted individuals in society. But in general terms, also clinicians are affected by this global trust crisis in health and science information. So it's the role of public health, it's the role of medicine, it's the role of policymaker, it's the role of journalists or scientific publication, it's the system as the whole that has to provide the social support for parents. And it starts with community engagement, with organizing forums in which parents, providers, community-based organizations can speak together, analyze the issues, find solutions that meet the needs of specific parent groups.
Yeah, I love that. I think, we sometimes forget the community, the very important community voice in all of this, right? And understanding, true understanding from true listening, right? About what the needs and what the gaps are as we come together and think of a better sort of future moving forward. Melissa, what do you think? Whose responsibility?
I do think everyone, I think as everyone has said, I think just to kind of hone in a little bit, I think from the pediatrician's point of view, I think we sometimes need a little better embracing going into the media. Like, I think it's hard. And I always, sort of like, oh, do I really want to do this interview? Do I really want to, because you're worried you're going to sort of say something wrong or something really taken out of context. That's part, I guess, the trust, Randi. We could talk about that as a different question. But I think that the more that people who are willing to kind of be in the media to sort of take that trusted relationship that you have with your patient. And many of my sites have shown, right, that doctor recommendation is probably one of the most important things in healthcare decision making. But I do think it also, when you read an article and you sort of see Dr. So-and-so from so-and-so, place, that helps as well. I think, don't do a lot in social media, except for you, Edith, that you're amazing and that you sort of are trying to kind of meet people in social media where they are. Because I do think more and more people are getting their information from social media. And you know what? I do too. You know, you're looking at Instagram, you're like, what? And you have to stop and be like, wait, that can't be, right? So the more that you can kind of get those trusted voices out there where parents are and are getting their information, I think is helpful. I think from the parent point of view, being able to stop for a second and say, like, does this make sense? Like kind of that kind of face validity we talk about, or the sniff test, or does this make sense? What I'm hearing, maybe it doesn't. Let me talk to someone about it, rather than you know, we're bombarded all the time by information. And then I would say that, like, a special plea for parents for their kids is also teach your children, about kind of how do you look at the evidence. And we kind of try to do that with our own kids, and started really when they're really young as well, because they are going to be out in the world and have to do this themselves as well. And so kind of starting really early on, how do you know if something is true or not true? Like, how do you know if you look at these numbers, does that make sense the way this graph looks, or maybe the data isn't quite right? If you can kind of start that early, that will help them, I think, in their future lives as well.
Yeah, I love that. And it's something I have to tell you, I wish I had more time to sort of discuss with my patients in clinic, right? Like, and also let's teach children, safety about this, safety about that, let's keep them safe in this way, that way. And then also slowly teach them how to, be smart consumers. I do also think, again, I spend a lot of time on social media. I do think some of the responsibility needs to be with these platforms. I think, we have unfortunately lost all kinds of content moderation. And anything goes, and its popularity is sort of taking the place of credibility and true, expertise. I think popularity is reigning over expertise. And it's not a fun place out there. Creators have all kinds of incentives, right? And every time you create something, you're given all these metrics for how long people watched your video and how many people they shared it to. So the incentive is to do all kinds of shenanigans, right? To keep people watching longer, which is how these companies make money. And I do think, unfortunately, a lot of the responsibility is with them. They're making these platforms that make us keep watching. So I do think a little bit of holding them accountable is important. And, telling parents, it's not you, it's not your child that there's something wrong with, right? It's like these platforms were designed in this way for a reason, and it's to make money. Okay, let's talk solutions though, and definitely please keep sending us your questions in the Q&A. We will have time for questions. I'm curious about solutions. So, Melissa, let's start with you. What can doctors do in this moment, both in our practices and in the larger conversations that are taking place in the media, on social media? You started to mention some of this, but what would be sort of your call for physicians who are hoping to be part of the solution?
Yeah, I think maybe it's as I'm getting older, I think that we talked about this before, like being able to embrace the gray. And I'm not mean the gray in my hair, but just the gray, because I think that we tend to, I think, try and be very black and white about it, like this versus this. And Randi mentioned this earlier, and I kind of refer to this, that I think it's okay to have those conversations and say, like, I know you have questions about this. Let's talk about it. Let's talk about the risks and benefits. I always like to say, you talk to a GI doctor, like they'll never take Advil, right? Because they see patients come in with GI bleeding. But, last night I took, I had a headache, I took an Advil, right? Like we sort of already in our lives sort of understand that there are sort of risks and benefits to things. And it's okay to, when you talk to families about vaccination, for example, right? They have questions, it's okay to say, like, this are the common side effects, these are the rarer ones. This is what, could happen. This is what I'm trying to protect your child against, right? This is the disease and this is what can happen.
Right.
And as opposed to sort of saying, like, no, just trust me, your child to get this vaccine and just move on if they have questions, right? That's not going to help them. And it doesn't necessarily help with the trust. So I do think being able to lean into those questions. I also know it's hard, right? You have 15 minutes with the patient or 20 minutes if you're lucky. And sometimes it may be that you're gonna have that conversation and say, I'm not going to get this and this today. Like, let's make another appointment and talk about this again. If we talk about vaccines in particular, we talk a lot about that. Like sometimes, a refusal, vaccine refusal is just a decision to talk about it again the next time, right? That's okay to say, well, can we at least agree that we'll talk about this again, when I see your child back in 2 months, or in a month, or, can we have a video visit and talk about it, right? That's okay to sort of say, like, try and meet parents where they are in that conversation.
Yeah, I love that. And I think, Melissa, you and I have had some of these conversations, right? I mean, full disclosure, we're in the same department, in the same division. We're both pediatricians, right? And I think I've come to you when I have, been called upon to talk about some of these things in the media, to just say, like, am I getting this right? Like, can I just talk to you for a second? Am I getting this right? And I think, some of the things that you have taught me, which are so helpful, is this concept of, like, when we fall into the black and white, like, no, 100%, nothing's ever going to happen. And then something does happen, then we lose trust. I wonder if you can share with people, again, maybe it's physicians who want to engage with larger media. How would you say that, Melissa? Like, how would you say this is still safe, but yes, there are side effects. Those are real. Like, how would you say that? How would you frame that message?
Yeah, I mean, I think, it's coupled up a lot actually with the measles. I've been doing some press around measles. Yeah. Obviously, like, I'm as pro-vaccination as you can get, right? I think everybody should get the measles vaccine. And so I think when I talk about it, I say, like, the single most important way to prevent your child from getting measles during outbreak is to get vaccinated, right? Like, there's no, to me, that's not black and white. And
clear message.
Clear message, right? And some people need an early vaccine, right? Okay, so you're traveling internationally, you're in an outbreak, et cetera, and kind of go through the information and try and keep it relatively simple. On the other hand, and we also say, like, the measles vaccine is safer than getting the measles, right? So there are very rare side effects to any vaccine, right? So I can't promise that in all cases, but I can say I also know what happens when children can get measles, right? So I feel very confident saying that overall measles vaccine is safer than getting the disease itself. And the reason we have the vaccine is to try and prevent these things. And these are all the things that I'm worried about. And if you have questions, like, go talk to your pediatrician, right? So, don't necessarily believe me because I'm some person on the media telling you this. Again, if you have questions, go to your pediatrician. That's what they're there for. And they'll be happy to talk with you about it. So I do try and kind of separate out the sort of, this is what we know, this is what we don't know, and then also, like, please talk to your pediatrician.
Yeah.
And I found it, I think, in general, to be pretty effective.
Yeah, I love that. I'm, and the reason I'm sort of asking you and following up is because I think, again, as Randi was saying, like, as messages get shortened, right?
Yeah.
As attention spans get shortened,
yeah,
sort of like, how do we squeeze it all in? And sometimes I almost feel like we can't. Like, it's just like, it's absolutely impossible, which is why you need to go speak to your doctor, right? It's like, no, like, when you're having a message about one thing, it's impossible to squeeze everything else in. So it's, sometimes and again, Melissa gets to what you're saying, we do our best. We show up with a clear message. We, acknowledge the nuance as best we can. But I think part of it is just being willing to show up to begin with and be in those spaces. Renata, I wonder, for you and some of the things that you have mentioned throughout our talk, when we're thinking about solutions, how do we build community spaces that really lend themselves and promote public health?
So first of all, it takes time. And this is something I remind everyone in my CVPR, community-based participatory research class, and also the community leaders who participate in the class remind our students. So it starts with becoming visible within the community, within a specific patient group, making sure that you go to the event, to the activities, also when you don't need anything at all. In general, when I approach a new community, a new patient group, it takes me 4 or 5 months just to start talking about the potential collaboration, because the trust needs to be built over time. You need to show yourself trustworthy. You need to listen to their concern, to their, basically priorities, and making sure that everything is done reflects their cultural values, the way of doing things and similar things. For a hospital or any kind of public health institutions who wants to create this connection, this community of patient spaces and co-design solution, it's important to first provide comprehensive training to their clinicians, to their employees, to the researchers, and to give the time for this additional activity. Edith, you're fantastic bringing all of us together here, but you know that the time is, the resources are really short for a lot of people. So both clinicians, community-based organization, and patient parents need to come together. And for this, we need time and resources. And advocating for time and resources is also our job in our institution. I also think, and I don't want to go too long, but there are two things that I wanted to add. One is the medical school curriculum change, which is something I speak quite often about. Melissa, before we were saying not a lot of clinicians are on social media, but because also there is not a lot of prioritization in the education on the interpersonal communication skills, empathy, compassion, social media skills. They are sort of considered soft skills. My is that there is always time to learn about a new manual about a disease, but those are skills that helps clinician work throughout the lifetime. And so it's important to prioritize support clinicians with these skills so that they can implement it throughout their career. And I have a solution for parents, but I don't want to take too much time. I have some suggested solution because no one here has the magic wand to take away this problem.
Please tell us. No, we want to hear. What are the potential solutions for parents, Renata?
I think that our grown-ups now, I relate really to the struggle, to the confusion that many parents experience, especially the parents who are working parents who have a lot of competing and conflicting conflict. I'm now a public health professional, an immunization advocate, and when I first decided to immunize my first child at birth against hepatitis B, I felt fear, okay? And yet I know that vaccines are tested on thousands and thousands of children. I know that they are effective and safe, but with the clinical team and the skills of the clinical teams that alleviated that fear, that made me going. So again, focusing on these interpersonal skills, on asking your pediatrician, and also for the parents, respecting the fact that pediatricians have limited time, schedule another appointment to speak about specific issues of concern, making sure that you had that dedicated time, join parent groups, look at evidence-based information like the American Academy of Pediatrics, support yourself and others in making the right decision for your child, and being an advocate for evidence-based information.
Yeah. I love that. And I can totally relate. My little guy is 3, and it's I have a pediatrician who recommends it in my practice, and when it was his turn, I was like, ugh, right? And we don't talk enough about that. We don't. And I think the acknowledgement can go a long way to someone who's trying to make a decision. And I think, both Melissa and I as pediatricians, but I know also you, Renata, and Randy come from the perspective that all parents are trying to make the best decision for their kids that they can, right? And I think even, and sometimes I have to tell you, I have caught heat online for saying this, but even parents who choose not to vaccinate believe that they are making the best decision for their kids, right? And I think that is again something that we don't acknowledge enough. And I think when we do, when we see this in practice, right, in those one-on-one conversations, I know you know me, I've hopefully been of help in many other situations and circumstances. I'm recommending this, right? Like in those conversations, it gets a little bit easier to address. But I think the online world is not set up for the nuance in the one-on-one discussions and the I see you see me kinds of discussions, which is why I think we all are advocating for parents to come to their pediatrician to bring the questions there. Randy, I'm gonna stop talking. How do you think health journalists can step up and rise to the occasion within the constraints of the pressures that we were addressing? What do you think are some of the solutions here?
Well, I was going to talk about both health journalists and then readers of our material.
Oh, I love that.
So I'll tack on both. But one of the things I do tell my students is, especially those students who are used to writing school papers, that, whoever reads it's going to read the whole thing. We have to realize as health journalists that there's a good chance, even if it's only 8 paragraphs, that people might only read the first 4. So if you're publishing, if the point of your article is to say, here's this study that is like all over social media, and I want to tell you where they got it wrong, you better put that I want to tell you where they got it wrong in the first or second paragraph. You can't be like, look how amazing, look how amazing, look how amazing, but, and there's a huge but, this is potentially dangerous. You always have to think that the person could, people want to read enough either so that they have something to talk about at a cocktail party and feel a little smart, which could be the headline, or they're reading it on the toilet and like then they're done, so then they're done with your article. And we're not writing these hefty books, they're reading it online. And so I think we have to think about that. Any skepticism has to be brought up. So I think that's important for journalists, and to recognize that people might not get to the last paragraph unless like my mom will. But other than that, I can't really trust, anyone else. My sister, she'll read to the last paragraph. But for parents and doctors, I push 2 things. One, I think doctors owe it to themselves to see the kind of crazy stuff that's out there.
Oh, yeah.
I think that it really behooves all doctors, if they want to have a trust, that when their patients come in and say, I just read in People magazine, or I just read, maybe they do a good job, so I don't want to name names, but like I just read on this social media platform, X is what we have to do. I think it's great for doctors not to say, roll their eyes and say, I would never go on that platform, but to be like, you know what, I saw it too. I actually read that and I can see where it's coming from, but here's what bothers me. I think that gains trust. Like, oh, you can relate and you don't think I'm an idiot. It also opens up a door that you don't have to feel weird about telling your doctor. I was thinking of giving my kids this supplement. Okay, now that you don't think I'm crazy, can I tell you what I heard about this other pediatrician on TikTok? And then you can also say, sure, yeah, I see her also, and she's got some great stuff, but here's the thing that makes me a little worried. So I think that kind of builds bridges. And then for people reading, you don't have to be a statistician to know certain things. I think that a few things are, if it's a study of 8 people, if it feels like a tiny group, like, enough people that you could sit around a dinner table with, it's too small of a study and you shouldn't trust that. I think that we can also get clues from, if they do say, and they should, so-and-so who runs this drug company says this is the greatest drug company. Sometimes they do have conflicts of interest that are right there in the newspaper. So you should keep an eye out for that. And then this is getting a little more nuanced, but I think in terms of the outside comments, I think you can read, like if there's a study that says this is, if new study says X is good for your kids, if the outside comment, which they usually do in newspapers, so-and-so who wasn't involved in the study, if that person says something like, oh, well, that's intriguing, I'm waiting for a confirmation study, that's a polite way to say they don't believe it. Like that should make you feel this isn't ready for prime time yet. If they say anything other than this is great, I would endorse this. If they don't say that, think about it. This is an intriguing idea. I may not put that in my practice yet, but it's intriguing. That should sort of raise your discomfort. So I think there are easy things, easy-ish things parents can do when they're reading. And yeah, I think doctors owe it to themselves to spend a little time seeing the wacky stuff that's out there.
Yeah. So informative, the wacky stuff that's out there, I gotta tell you. And so informative, the things that people will tell us when we put ourselves out there. Some of it is like you kind of have to be ready, right? To be on the receiving end of some of the things that, the internet puts out there. But I think very, very informative. Melissa.
Yeah, just to add to that. I mean, I think we also want to know, right? I mean, you have to prepare, but I do think when you open that door, you want to know if your family's taking a supplement, your patient's taking a supplement that you didn't know about, right? Or, or maybe something that you're trying to like figure out what's going on with them, and then you realize that they're not telling you all of the things. So I do think, when you're kind of taking the history or being open to it, and I do think sort of seeing, yeah, like we know there's a lot of information out there. Like, tell me some of the stuff that you've been reading, or open yourself up to those conversations. I think are really helpful, and I think it happens kind of in any kind of healthcare situation, right? If you're sort of closed off and they think you just sort of like, this is my way and there's no other way, then you're not gonna get to sort of where you need or you want to be as a dyad, right? As a family and a patient. I don't know, as a triad and a doctor. So I think being open to those conversations. One journal I started to do, which I think is really interesting, is actually have a page. It's called a patient page. So the JAMA Pediatrics, not in all their articles, but they actually have a very short article that goes with articles that's sort of like for patients or for parents, that sort of talks about, okay, well, this is what the this article is about, and this is like what the family, like you as a family might want to know. I think that's really interesting, and I would love for more journals to do that. And I think for scientists, like, to be open to that when they offer to like do a patient page for that, or to do a video, or to do something that would be a little bit different than the scientific writing, so that information can get out there in a different way.
Yeah, I love that. I hope that model spreads because it seems like a brilliant model. Randi, one more question I had for you and for everyone listening. And we again appreciate you listening on a busy school night. And I know that a lot of you will be listening after this recording at a later time. So I'm sorry that you can't send us your live questions. But one more question I had for you, Randi, is, how so two things, right? So first, I think when I have sort of engaged with some of these conversations with my families, one thing I always tell them is like, you shouldn't feel scared, right, by things that you see online. Like people that are very much trying to like scare you, spread fear, and then sell you some sort of solution. Like there should be sort of like a gut check there that something is not right. So the first part of my question is, what other gut checks should be there as people are consuming health information online? And then also, which is the second part of my question, who should people trust in this time, right? Be you could go to the CDC, you could go to, some of these places, and I think some of that trust is being eroded right now, right? I'll just say it that way. Some of that trust is being eroded. It's getting a little tricky right now to trust. So what do you think? Who should we trust? And what are the gut checks that should be out there that families should remember?
I think gut checks are if it sounds too good to be true.
Oh, I like that one.
Like, it's like I see things like this has no side effects. Everything has a side effect. Our conversation, I hope, is having a side effect right now on people, like, but everything has a side effect. Even the healthiest thing might, if you do too much of it, can be dangerous. It's all in the dose. So I think if it seems too good to be true, if it's a blanket statement, we are all so different. Nothing is, we shouldn't all be dairy free, or we shouldn't all be on dairy, or we shouldn't all be taking a certain supplement. So anything that sounds like, other than vaccines, anything that sounds, every single person needs this, we should think about that. Who to trust? I do think, and I could get pushback. I'm sure maybe someone on a comment. Well, I do think that I still trust academic sources of knowledge. Like I do think that go to the Columbia Children's Health newsletter. I think that those are, academics that care. I think there's other, there might be other universities, which I haven't heard of yet, that do newsletters too. But I think that when people are not sure right now coming down through I think that academic ones are ones that you can trust.
So if I can add something, I also want to add the level of proximity to the person who's disseminating the information. During the COVID-19 pandemic, for example, we saw that a lot of misinformation was spread in the news by different experts who had different opinion, but your pediatrician is the one who holds your child's hand, who's the one who really is with you since the beginning of the life of your child. So the level of proximity, whether it's the pediatrician or a trusted family source, so if we want to go, and I agree with Randy, academic sources, professional society sources that you trust and you've encountered before, should be also a gut check, to use your term, Edith.
Yeah, yeah, I love that. I love that. And I'll make a quick plug for the American Academy of Pediatrics, who I work very closely with, the Healthy Children website, as well as the Healthy Children podcast, which I host and Melissa has been on. And again, it's trying to get the best information possible out there. And so I think when families find us and when they do, they stay. I'll just say that when they do, they stay, and it's so rewarding to see that. So let me just ask you all one more question, and we'll get to anything that the group listening this evening may want to ask us. But I think a lingering question for me is, how do we work together, right? Like, how do journalists work with doctors? How do doctors, journalists work with public health systems to set up channels that are resistant in some ways to these outside forces, like what I was saying, the obscure algorithms that govern social media? Who wants to take that first? I'm sure you all have
Maybe I'll
thoughts.
start. I mean, I do think, as I mentioned before, I think as doctors, kind of putting ourselves out there to be in the media. I would though say to my media partners, I've definitely, there are journalists who sort of will say, like, this is what the article is about, these are the questions I'm going to ask you. Yes, like I'll sometimes say, can I see, I don't know the whole article, but like if you're going to quote me, can I see the quote, just to make sure that what I said was accurately portrayed. And I find that in some ways that some of the journalists have been around for longer, I'll say yes, of course, that's fine. And maybe the younger ones sometimes do and sometimes don't. And maybe because they feel like that's, I don't know, well, Randy will tell me in terms of more of the teaching part of it, but I think that makes you feel more comfortable to say, like, I know what I'm going to be asked. Otherwise people just say, like, no, I don't want to speak to a journalist because you're worried about the gotcha, right? Or the, like, what if you kind of didn't say it perfectly? You want to be able to, because as a doctor, you want to make sure the information you're giving is correct, right? You want to make sure you're getting across the message. And also our tenet is first, do no harm, right? So you want to make sure that if you're going to be in the media, that you aren't doing harm in what you're saying. So I think there's this, we talk about trust between patient and doctor and trust with, with public health sources. I think there's also trust between doctors and media, particularly for doctors who may have been burned before. So that's what I would say is I think we need to put ourselves out there, and then we need our journalist partners to make us feel comfortable in doing that. I think doctors on social media, I think that's harder. I believe that you have to train all of us how to do that. Because I think that's a bit, I haven't quite crossed over to that yet.
That is like a whole nother talk for a whole nother day on how we do that and do it well. I think the bottom line is, again, right, like messages that we think are helpful and then finding the format, right? I think sometimes the format is a newsletter, sometimes the format is, national media, sometimes it's local media, sometimes it's, radio, sometimes it's television, like sometimes it's just the format varies. I think for us to just acknowledge that there is a message and an importance to it to begin with. And I think the same sort of applies to social media. Randy, what do you think? How do we work together? How do we all sort of come together here?
Well, I do think that as a seasoned journalist, I do, when I'm not playing gotcha, like if I'm talking, and I tell my students this, if you're reaching out to a doctor to explain something and to get a quote, and you trust that they're a good source, go to PubMed, go to read some of their stuff first. They're giving you time and to make, we're using up your time for free, and we're not, oftentimes you don't need to be in the media, you don't care, you're more worried. So do your background. I don't always tell people, here are my questions. I like to have a conversation, but I will do my homework so I can say, here's why I'm calling you, because you had this article in 2021 about X. It lets people know, it lets your source know you did your homework. Yes, we're not going to show you maybe the entire article, although sometimes I do, because, I want the feedback if I sort of have a connection with the source, the expert. But I will always say, I will come back and read to you your quote. And I think it helps because sometimes, yeah, I miss a little nuance. I paraphrase and I use a word that, to me, I don't know, like even as a young journalist, you could shove the word enzyme in there and they're like, no, it wasn't an enzyme. It was, this protein made by whatever. And those little things are important to know. So that's what I tell my students, that you should go back and read the quotes. Now, there's a caveat to that. And I've done this, if I am trying to spotlight that there's someone spewing false information and I talk to them and they say something really crazy to me and they're a media person and they know the way the media works, I am not calling them back and saying,
Nope.
I just want to go over this with you. But to a trusted source, I always do. I've spent my whole day doing that today. I also tell my students, I always go back and read everything back to a patient who's told their story, because we love to say we're giving patients a voice. We're exploiting their story for the benefit of our career. Like, the more weird or whatever their story is, the better for us. The more intimate details, the better for us. We owe it to them to read back how they're going to be portrayed. And it's uncomfortable oftentimes, but they're going to see it in print and you owe it. And also, for selfish reasons, you're building a bridge with that expert. And the next time you call, they'll pick up the phone because they know you're going to quote them accurately. So even for pure selfish reasons, be a trustworthy journalist, because then you'll get more information. And then maybe they'll say, hey, I have a paper coming out in 2 months. It's embargoed, but I'll give you all the information now if you promise not to write anything for 2 months. It'll help your career to be a nicer, more accurate journalist. The one thing that, and I told you before we started today, I had a little issue today. I think these organizations need to be more responsive to journalists. I can tell you that the American Academy of Pediatrics was wonderful recently when I was checking facts. I had wonderful conversations with some amazing pediatricians who were correcting some stuff that I thought that the Academy supported when they didn't. Another academy in another specialty, which will go unnamed, has not returned my calls. And I'm like, no, I'm calling your media office. Like, you should get back. And I do know from being a freelancer to different places, if I'm working on a piece for the New York Times, they call you back in a second. If I'm working on something for my book, they're like, well, it doesn't matter that much. Maybe we'll call back. Maybe we won't. I think now with social media, even if someone's working for an obscure publication, that journalist might be really good on TikTok or whatever. So it behooves you, if you're whatever organization, to call back so that your messaging gets out there. Like, I had wonderful conversations with the American Academy of Pediatrics today that really enhanced what I'm writing. And another specialty has still not gotten back. And I thought, how ironic, when I'm going to be talking about medical communication, their media people should be responding. I mean, because I hope I don't misconstrue, but Yeah.
Yeah, fascinating. Honestly, Randy, and hearing you speak, I'm glad that the American Academy of Pediatrics has been so helpful. That has been my experience with them as well. I also know that the Columbia Medicine media office works incredibly hard to vet requests that come through, to respond to them, to match them. I mean, they're like so diligent. They're a small but mighty team. But I think, listening to you talk, I think even for physicians who want to do some of this work, knowing that there is such a thing as being able to ask for their quotes to be read back to them, it's a huge relief, right? Like, yes, I'll give you an interview just so you know I'd like my quotes back. Are we cool with that? Like, like just knowing that that is an option that they have might be reassuring. And knowing that again, you're training journalists to have that level of, I think, decency, right? And I think yeah, integrity, I guess is the word I'm looking for, is reassuring as we try to engage and put ourselves out there. Renata, what are your thoughts on how we work together?
So the conversation shifted to working specifically with journalists. So I'm going to say my two slides. You can invite journalists to how to work on public health topics, on health equity topics, and how to pitch the media. One thing to understand also for everyone who wants to do this work, that Randi is an exception. She has an ND and MPH. The vast majority of journalists do not have health-related experience prior to being many years in the job. And some of them become excellent at health issues. But sometimes it's also, like you were saying, involuntary, that some misinformation or miscommunication may spread because the journalists are not in health science issue. So it's important to understand their language, their objectives, their priorities, and everything else. The general question, the only way that we can all work together, and I will argue public health, medicine, journalism, and patient groups, and parent forums, is to do more basically forums like this, like organizing, is to create opportunities for engagement, is to actually train people on multi-sectoral partnerships across the different kind of disciplines. I'm always surprised, for example, that the public health curriculum, medical curriculum do not have skills, conflict resolution, all those skills that are common in business, common in international affairs, and are important to this work. So having the language of different institutions is important, making sure that we involve also parent groups, patient groups, so we can listen to them, we can listen to their concern is very important. And ultimately, this is going to lead to better interaction, both in interpersonal settings, like the provider-patient setting, but also more in general in the public health sphere, in the health system sphere, in the social system sphere. This is too important not to do it. So thank you again, Edith, for organizing this, because I feel those conversations needs to be happening more.
Yeah, I couldn't agree more, which is why, I'm so grateful that you all give us an hour of your evening to have this discussion. We will be sharing this discussion, the recording of it, on all of our platforms. We will also be sending it out on the newsletter, and to everyone who registered this evening, email with a recap from the conversation today. So if people had to sort of be doing multiple things, multitasking this time of evening, or weren't able to listen to the whole conversation or log in real time, you will also get a recording. I'm really just so grateful to you all. I hope that we continue to have these conversations. I definitely am committed to continuing to bring people together. People are sending their thank yous on the chat. Thank you all really for giving us your time. We will do it again. And thank you to everyone who joined this evening. What a great way to end our conversation. Thank you all so much.
Thank you.
Thank you.